So I have a question. How many surgeries do you think it takes to determine that you have cancer? One might think none. That would probably be about right. One, one might think one. For a lot of people, that's the case. For me, it was three, which seems like a lot. Sort of is. And in my case, my cancer was found by accident when a general surgeon, was doing gallbladder surgery, which some of us may have had. And it was discovered that I had ovarian cancer. Oh, I heard it. Oh. That's the noise I get whenever I tell somebody when they say, oh, you're a cancer survivor. What type of cancer did you have? Did you have breast cancer? No, I didn't have breast cancer. Not that there's anything wrong with having breast cancer. However, I did not. And everybody says, oh. You know why they say oh? Because ovarian cancer is the silent killer. And it does kill most people who get it. And the reason it does is because it's very hard to diagnose. And most of the time, by the time it's been diagnosed, it's pretty far spread. So in my case, as I said, it was found by accident. I'll give you a quick rundown on my history. And that was, I was planning my daughter's wedding. I was working as an executive for a company. I was busy traveling around the world. Had to have gallbladder surgery, kind of put it off a little bit, finally decided to do it right after my daughter's wedding. And general surgeon said, I didn't like what I saw down there. I didn't know down there was any different than your gallbladder. I thought I knew where my parts were. However, down there, for those women that are in the audience, is your pelvic region. We'll get into that in a minute. I know I'm offending some men, but this may get a little technical for you. So anyways, moving on. When we get past my daughter's wedding, I have some surgeries. I go through the fun of being diagnosed with cancer. If anybody in the audience has ever been diagnosed with cancer, it's a bit like getting hit in the head with a baseball bat. You feel like your whole world, some people say it's like the rug being pulled out from under you. I like the baseball bat in the head because that's really what it feels like. In my case, I was diagnosed in 2014, had a surgery to remove quite a bit of my innards, let's just say, and followed by chemotherapy. Then I was, as I call it, fat, dumb, and happy, moving on with my life, thinking life was grand. 2 years later, had a reoccurrence, so in 2016. But since then, we'll get into that in a moment, I am what we call NED, which is no evidence of disease, which is a good thing. Thank you very much. If I could dance in front of people without embarrassing my family who's here today, I would, because there's a shirt I have at home that says Dancing with Ned. NED, which is, it's a little bit of a humor thing. So anyway, back up to when I was in the hospital the first time with my first surgery. And if anybody's been in the hospital, they know what this little assessment tool. You know, the nurses come in, they say, where's your pain level? Well, I'm a mom. My children are adults, but I'm still a mom. If there's any moms in the room or watching, you think, well, I'm gonna be brave. I'm in the worst pain of my life, worse than childbirth. I feel like, you know what? But my son, who's an adult, says, standing there looking at me, the nurse comes in and says, Mrs. Giessert, where's your pain level? I say it's about a 6. My son looks me straight in the eye and says, Mom, you say it's a 6, but your face is a 10. And he was right. And so the humor piece, it's sort of in our family, we've used humor to break tension. And that's where, when I was asked to speak, I decided to try to talk about how I learned to laugh at the fact that I have cancer, because it really isn't that funny, but we try to laugh at ourselves sometimes, and in our family, it's kind of what we do. I put some initials up there. It's called TFS. TED Talk has some rules, so I'm not allowed to cuss. So let's just say that means this effing sucks, because that was my philosophy. When there's also in your room, there's a little whiteboard that you could write up there what you want to tell the nurse, and that was what my son wrote up there for me. And you may have heard that I'm related to somebody associated with this talk. But anyway, let's move on. There's a lot of data here. I tried to make it bigger, but I couldn't. So the takeaway from this is the way the experts look at gynecological cancers, and most of them are referred to as ovarian cancer, even if they don't start in the ovaries, and that's what mine did, is by relative survival rate for 5 years. 5-year relative survival rate. Doesn't seem like a great thing, especially when you're the one with it, but there's percentages. It's based on staging. people say, oh, what stage was your cancer? Where was it? All that kind of stuff. You don't want to know because it's really not great. In my case, it was stage 4, which means that it's progressed, but it wasn't what they call distant, which means it's metastasized, because they talk about it as to where it's located within your body. Because your ovarian cancer is kind of an interesting type of cancer, let's just say. So the survival rates don't look great if you can read those numbers. And if you get a reoccurrence, the survival rate numbers even are worse. So that's why everybody that knows about it goes, oh. So it is kind of depressing to even talk about. But here's my weed picture. No, not that kind of weed. Weeds in your garden. Because my gynecological oncologist, yes, that's a mouthful, but there is such a term, and there are specialists, and if you want to become a doctor, that's really a great doctor to become, or a nurse, because they need lots of them. We do have one in the audience. I won't point her out. But anyway, the bottom line is that gynecological oncologist, my doctor, explained to me that your ovarian cancer is like weeds in your garden, because I didn't quite understand why we had to do all this. The surgery is to remove the weeds, right? You pull them, you remove them. Chemotherapy and radiation is like weed spray, to spray it down. But what happens sometimes? The weeds come back. That's because there's little seeds that are left within your body, and they grow back again. So that's the way I look at it, and that's the way it is. We're going to talk about chemotherapy for a minute, because when you start chemotherapy, if you're a cancer person, they give you a little document and they tell you what your side effects are going to be of chemotherapy. And the first one, that's the worst thing that you can happen, they say, is losing your hair. And I always thought that was a little odd, given the fact that I'm married to a bald man, and the fact that I thought, well, losing my hair can't be all that bad. And this is the list of more. There's another page, but this is another list of things that happen when you're on chemotherapy. And trust me, all of these are way worse than losing your hair. And this next group, these are ones that in some cases, they don't go away when the chemotherapy stops. So you still have them. Like my family might say my mood changes are still there, but that's to be just, we'll see about that. But anyway, so I did start thinking about the hair loss thing, because it was a big deal for me, and listening to other people, because it was a big deal, not just for women, but for men as well. That's a picture of me without my hair, where my hair was thin, because I never quite lost it all on the top of my head, because I have very thick hair. However, I did lose it everywhere else. So my eyebrows, and now with masks, I can't imagine walking around with no eyebrows and a mask. There'd be no facial expression at all. So I'm not quite sure how people would deal with it. But then I started to think that really probably the worst thing is the fact that people would know. Because you walk around, if you're a woman and you're bald, or you're wearing something on your head, and you go in the supermarket the one day of the month that you feel like getting out of the house, and strangers look at you with that pity, and you think, oh, they know I'm going through chemo, or I just did. And so that, you might not be ready to share your story yet. So that to me is maybe why hair loss is such a big deal for some people. The sidebar is you do lose it everywhere. So for women, no more shaving your legs or under your arms, and you lose it everywhere. So we won't even go there. But anyway, so moving on to cancers. As I started to say about breast cancer and gynecological cancers, those are the two biggies when it comes to women with cancers. Not that there aren't other cancers. I was a big breast cancer supporter, breast cancer awareness supporter. I have a lot of friends who have fought breast cancer and won. I have some that have fought and lost. The thing that I think is great about breast cancer awareness is that it has brought a lot of money and a lot of awareness to a disease that now is very preventable and very treatable. Not that you can't still succumb to it, but it is preventable and treatable. So I'm here to hopefully educate a little bit more on gynecological cancers, because they're not as much talked about, maybe because it's the parts of the body that we don't like to talk about. But I don't think men really like to talk about breasts when it came to things other than, okay, sidebar. But now we have football players running around with pink sneakers on in the month of October. What I would like to see is them running around with teal sneakers on in the month of September, but maybe we'll get there. So This is a diagram of your anatomy if you're a woman, and hopefully you know where all your parts are. And if you're a man and you don't know where all your woman's parts are, there they are. And those are the proper terms for them. So if you don't know what they're called, that's what they're called. And if you have children, young children, I would please encourage you to tell your children to use the right terms for their parts. Because if they don't, then if something happens and they have a problem, they're going to say, oh, mommy, my pee-pee poo-poo is hurting me or whatever. And that's not going to be good. Or, God forbid something happens, you want them to be able to explain to you what's going on. But sidebar, these are all the areas that are considered gynecological cancers. And yes, as women, we can get cancer in any one of those places, and none of them are very fun. I did circle some at the bottom. Those are ones that, cervical cancer, most women go annually to get a pap smear. Yes, that's a way to help determine early amounts for cervical cancer. However, there's also another way. There's a vaccine that you can take called the HPV vaccine for anybody that may have gotten it as a young child or as a young adult. That's also another preventative method. So there are ways to prevent those cancers from occurring. However, the other cancers, fallopian tube and ovarian cancer and uterine cancer, not as much easy to diagnose. So there is a blood test you can take, but not 100% way to diagnose it. So how do you know how you can find it? These are the symptoms of gynecological cancer. Well, I don't know about most of you, but for most of us, we have those every day. I think I got a little indigestion right now. So how do you know that it's cancer and not just a normal everyday whatever's going on in your life? My husband would tell me he gets ovarian cancer every time he eats bad food. But it's not about what you eat. It's about consistently having something going on in your body for about 2 weeks, the same thing in the same area for at least 2 weeks. You really need to go have it checked out. And the other thing I would say as my medical infomercial here is if you are a woman past your childbearing age, like I was, I know I look so young. That's what my doctor told me. You're so young to have ovarian cancer. I'm like, I don't feel young. But anyway, if you're past childbearing age and maybe you've already had your uterus out like I did, but you still have your ovaries, you still need to go and get checked. Even if you're not getting a pap smear, you still need to go have, all right, close your ears, gentlemen. It's called an internal exam. Yes, women have to do it every year. All right, now, what not to say to somebody who's going through chemo treatment or cancer treatments? These are some that just irritate the crap out of me. I hate journey. Oh, you're on a journey. I don't know, my journey would be a nice vacation somewhere. And if I'm gonna have fun, it's not, you're so lucky, you're so this, and I know people are doing their best and they're trying to be supportive, but I will tell you what to do. Don't send stinky flowers, because they remind you of a funeral. Send funny cards, just show up. You know, my best friend said, what can I do for you? I said, just come sit with me once in a while. And sometimes I'll sleep and snore while you're there, but just be there. Or have people show up and fold your laundry. One of the hardest things too is to be able to ask for help, but you need to be able to ask for help when you need it. And the reason I put up there the definition of survive and thrive is one of my friends in one of my cancer support groups said she likes the term cancer thriver, not cancer survivor. So I had talked about what I was going to talk about today, and I kept saying surviving cancer with humor because everybody says blah, blah, blah. And you just, when you see strangers, I say, oh, I'm a cancer survivor, I'm a cancer survivor. But then I started reading what the definition of survivor is, and it's really so negative. It's just all about death and destruction, and you survived a war, or you survived something horrible. For me, thrive is about prospering and flourishing. So to me, that's a positive thing. So I look at it, that's what I want to look at, is being a thriver, not a survivor. So I thank my friend for giving me that term. So I guess I'll change my title slightly from surviving cancer with humor to thriving with positivity, because to me, having a humorous perspective is having a positive attitude. And as I said, in my family, we laugh, we joke, we make fun of each other on a regular basis, but we do it with love. And I also have seen a lot of my friends that have struggled with cancer and other illnesses that have a very negative attitude. And as some of our other speakers have talked about, negativity can affect you emotionally as well as physically. Having a positive attitude is really the most important thing in my opinion. This is my why. This is why I continue to do what I do. This is my husband, my children, my grandchildren, and my dogs. This is why I get up every day on the right side of the ground, and I, as I say, fight the good fight, right? I love my life. I continue to live it every day. Is ovarian cancer going to kill me someday? Probably, but we'd all have an expiration date. We don't know what it is. There's buses, whatever, we don't know how long we have on this earth. So for me, I choose to live my life with happiness and positivity. I choose to live it in such a way that I will fight as well as I can. I'm on maintenance infusions every 3 weeks. I go. I still got my port, for those of you that know about ports. I go every 3 weeks. I feel like for about 2 days, and then I move on. And now that I'm boosted, I can move on with my travel and get back traveling the world. I don't have to worry about anything else except enjoying my life. Thank you very much for your time.